Good morning. My name is Nick Grant, and the title of my equity talk is Leadership is a Journey of Service. This is probably the 15th or 16th title I've come up for this talk, and I assure you it's not the same title I was using yesterday. In fact, when asked to prepare a health equity talk focused on self-reflections and lessons learned from 9 months of participation in the Atlantic Fellows for Health Equity program, this isn't even the first talk that I wrote. That talk focused on mental health equity and my day job as a clinical psychologist in the United States Navy. I really liked that talk, but the powers that be wanted me to go another route, and so I went back to the drawing board and started over. To prepare for today, I thought about the things in life that I'm most passionate about. And of course, the first thing that came to mind was Beyonce. And then I remembered how one of my best friends actually won the ticket lottery and was able to purchase tickets to the concert, but only bought 2 for her and her mom. And I still love to antagonize her because she could have bought 4. Once I was able to calm myself down, I thought again about my passions and my values and considered where I spend most of my energy in my life. And then I realized for the past 20 years, I've spent most of my energy studying to become and practicing as a clinical psychologist and working to support and uplift LGBTQ communities and individuals. Now, you may be thinking, what does psychology and LGBTQ psychology specifically have to do with leadership? And the answer to that is nothing really specifically. But let me tell you a little bit about my story. I was really fortunate early on in my career, in my doctoral training actually, to find an intersection of my 2 interests. And I got to study with Dr. Peter Goldblum at Palo Alto University's Center for LGBTQ Evidence-Based Applied Research. We're psychologists, we like to use a lot of words. I found the intersection of my passion for psychology and working with LGBTQ people and communities. But today, I want to talk a little bit more, or focus a little bit more on leadership and how we think about leadership, how we as leaders serve the people and the communities who empower us to lead them. It is common to think about leadership as directly related to a position or a title. Those in leadership positions must know how to lead, right? I think we all know that's not always the case. And I'm certain most of us have seen folks in positions of leadership who have no idea what they're doing. I certainly know that I have, and I also know that I've been that person in those positions. What if, instead of thinking of leadership as related to a specific position or title, we took a more developmental perspective on it? What if, instead of assuming you have to have a title to be a leader, we looked at leadership as a journey? From this outlook, we acknowledge that all people have the capacity to be leaders and to lead. This allows us to think more deeply about leadership in various contexts that it can come up in a person's life. For example, in one point in someone's career, they may be leading on a team or a project, whereas another person might be leading in their own family system, while others are leading in their community. And these are not mutually exclusive. This perspective allows us to see how different roles and different periods in a person's life provide opportunities to develop their leadership skills, styles, and philosophies. Since I have the stage and I love a long-winded story, I'm going to go a little bit deeper into my own leadership journey and tell you about how I learned of the power behind being intentional in serving those who you lead or who you're placed in a position to lead. Back in 2015, when I was just finishing my PhD, I received an email in one of the 52 email listservs that I'm a part of. And it was a call for applications for a student or trainee board position for the board of directors for GLAMA, Health Professionals Advancing LGBTQ+ Equality. More simply known as GLAMA, this US-based nonprofit focuses on advancing the field of LGBTQ health equity for all members of the community and equality for LGBTQ health professionals in their work and learning environments. GLAMA was founded in 1981 in San Francisco as the American Association for Physicians for Human Rights. And then in 1994, it had a sort of coming out, and they came out with a new name as the Gay and Lesbian Medical Association. Then, in 2002, it opened its doors and moved from being a primarily physician-based organization to welcoming all health professionals. And then lastly, in 2012, there was that renaming once again, and it simply became GLAMA. Now, I've been aware of GLAMA from my research and clinical training during my graduate studies, but was not fully aware of the then 35-year impact they'd had on the field of LGBTQ health equity. And they've been doing that work through 3 main pillars. GLAMA's first pillar is education. And that pillar centers around GLAMA's annual conference on LGBTQ plus health, which brings LGBTQ health professionals from various disciplines and various lived experiences together to advance that field. The second pillar is research, and that's focused on the Lesbian Health Fund. The Lesbian Health Fund is the only fund known in the world to specifically focus on the unique needs of LGBTQ women and girls. Since 1991, they've awarded more than $1 million to advance that field. And last but not least, GLAMA's advocacy arm is probably what they are most known for. For the past 40 years, GLAMA has been a respected leader in the US in LGBTQ health equity, with key stakeholders including US federal agencies and health professionals associations. Now, a little bit back to me, as I thought about my own journey and the possibility of applying for this important, impactful, truly fabulous organization, I struggled. I struggled with the imposter syndrome. I found myself doubting whether or not I had the skills, and more specifically, the leadership skills needed to be successful. You see, the position that I would be applying for was co-chair of the Health Professionals in Training Committee, which is charged with representing the diverse needs and desires of health professionals of all disciplines to the board of directors. So it's no small feat. Now, I've been blessed in my life and my career with a constellation of really amazing mentors. But during this time of contemplation, there were two mentorship pieces of advice that really stood out. The first was from Dr. Goldblum, my graduate school advisor. Dr. Goldblum told us, as LGBTQ psychologists, we wear many hats. Sometimes we wear a clinician hat, sometimes we wear a researcher hat, sometimes we wear our advocate hat, and so on. But regardless of what hat or fabulous outfit you're wearing, you have to center your community in the work that you're doing. The second piece of advice was from Dr. Mary Ellen Romero, who was my mentor and supervisor from my pre-doctoral internship at Tulane University School of Medicine. Dr. Romero also always told us that we needed to focus on the fact that US-based healthcare systems are businesses, and they're not usually designed for the success of the patients they serve or for the people working within those systems. Her intentional mentorship around always considering the macro and micro levels as a psychologist within a healthcare system really instilled in me a desire to always be intentional in my decision-making in the work that I engage in. So when reflecting on these pieces of mentorship advice, I decided I would apply. And the board voted for me into this new role. And I spent the next 2 years working to diversify the professional representation of the student leadership on the board. I worked very intentionally to broaden the disciplines and those working within the GLAMA community from student and trainee perspectives. And it went well. It went really well. It went so well, in fact, that the board asked me at the end of that 2 years if I'd consider applying to stay on for a 3-year member-at-large position. And I did. And then they roped me into taking on another leadership position as the VP of External Affairs. I don't know if that's because I'm an extrovert and I love to talk, or because of that work that I'd done for the organization so far. But they charged me with broadening GLAMA's behavioral health membership and footprint. So I worked really diligently to try and bring in more psychiatrists, psychologists, social workers, counselors, therapists, and other folks who work within the mental health field. That work still continues today. So 2 years in that position, and then something really crazy happened. The leadership of the organization came to me and asked me, would you consider running for president of the board? This was a huge and very humbling honor, and a huge step for the organization, which had only ever had a physician in this position in the past. So there I was again, nervous, afraid. Not naked and afraid, but afraid nonetheless. I was back at that point of wondering if I had the leadership skills to take on this role. And at this point, I really focused on what I thought it meant to be president, what that title meant. I thought that this position meant that you had to be the perfect spokesperson, that you had to make every major decision for the organization, and that you had to be a subject matter expert on every area that the organization was focused on or working in. I was focusing on the position and what I thought it meant. I was focusing on the workload and not the work itself. I was focused on the title and not the people. I was focused on all the wrong things. After some time, some reflection, some connection with my mentors, better or for worse, I decided I would apply. And in 2019, I started my journey as the president-elect of GLAMA. I served in that role for 2 years under the mentorship of then GLAMA president and senior Atlantic Fellow for Health Equity, Dr. Scott Nass. I'm so grateful for the 2 years serving in that role and for Scott's mentorship, because it allowed me time to grow and time to develop as a leader, and also set what my priorities would be when my turn came. My term as president ended just last month, and I'm happy to share my biggest reflection from the last 2 years of my leadership journey with you. I'm not sure if I got many things right, but I know that centering GLAMA's board of directors was the best decision that I ever made. Supporting GLAMA's community leaders and prioritizing my job as taking care of them was always my #1 goal. This decision came from my own growth and learning over the past year, and that helped me focus my own energy on taking care of GLAMA's leaders as a form of taking care of GLAMA's broader membership and community. Serving GLAMA and serving my community has been the highlight of my professional career, and I hope that sharing this story highlights the importance of leading as a form of service, leading with intention, and knowing that all people, regardless of position, can be successful when they center their community. If I could leave you with 2 things today, the first would be, I really, really, really love Beyonce. And the second would be that regardless if you are called, pushed, pulled, or voluntold, you have the capacity to be a leader and to lead, and that your strength as a leader will develop and continue to grow as your journey continues.